On Facebook and Instagram again.
Yay! Hi, I'm Jen. I'm a nurse injector here at Night Plastic Surgery. We're going to do something kind of fun with this. This is Sam. She works here with us. We are going to be doing some earlobe filler. So that's right, earlobe filler, because some people are like, what? I never heard of this. So very fun place to place some filler and beneficial, females and males. So I've done both. So as we get older, too, earlobes are thinning out, and then especially for females, wearing earrings when they're pulling down on those holes on the earlobe kind of stretch out over time. What we can do is place some filler to restore some volume and also just kind of support that earlobe and that earring. So very beneficial. Also, male patients have treated a lot of male patients. Thinning of the earlobes where they just look like they've aged. You can add some filler and actually rejuvenizes the look of the earlobe. It is amazing. So doesn't require too much filler. So Juvederm Ultra is what we're going to use. She did numb 20 minutes prior.
So that would be Group A filler.
Yes.
Not Voluma.
Here we go, a little pinch. So just like any filler we do, we're just using a needle with this. How's it feel, Sam?
Oh, it feels good. Doesn't hurt at all.
A lot of patients are super happy with this. It's amazing how the earlobe looks so much fuller afterwards too. And restored volume. Doing okay?
Oh yeah, doing good.
Perfect. So longevity is about the same as what it would be if we were using Juvederm in the lips. So about 9 to 12 months.
People are saying, let's see, what age can this be done?
Any age. So Sam, how old are you?
I'm 30.
So for her,
I forgot her
Sam just had a birthday.
I did. I almost said 29.
So for her, she's young. I've done a lot of young patients because we wear those heavy, cute earrings, and it definitely pulls down. Yeah. Pulls down. So Sam saw that we were, she's like, hey, would I be a great candidate? Yes. I don't put an age on filler or Botox because everybody's so different. So it's really about the anatomy and the end result for the patient. So whether or not you're a candidate. So that looks good.
Someone asked if it feels like getting your ears pierced.
Honestly, I would say less than that.
Yeah.
Did you numb?
Yeah,
Yes.
she numbed for 20 minutes. Our numbing works amazing.
I agree.
People are freaking out. They're like, this is so cool. I had no idea.
I know. It
This
is like
awesome.
so cool. So all my patients, whenever we inject this area, are like so happy. It's crazy how happy they are with it.
How much of a syringe per ear do you do?
It depends. So her ears are very small, and they're not too thinned out to where I'm already seeing the hole is. I mean, your hole is almost already like completely down to the bottom. It's already mid. So like, and I've used about a fourth of a syringe. So I bet about a half for her will use of Juvederm Ultra.
And does it have an effect on the hole? Does it close it up?
No, so I did just ask her because she has a second hole here, just so it helps me where I'm going to inject. I said, do you wear earrings here? And she said, no. I don't care if that hole becomes a little tighter. This hole will become tighter. It won't close it up because you're not injecting that much. But what it did is it basically just, decreased the hole. So it's going to give more support to the earring too.
So this is to help if someone has a big earring hole?
Yeah, so like earring hole. Some of it though is the look. Like I've injected a few male patients recently who had those earlobes that have thinned out and they've aged. So for males who keep, they short hair, you see it. I use the whole syringe of Juvederm, a half cc per side, and the appearance of the ear is amazing. So
Sam, your mom commented. She said, "Hi, Sammy. It's mom holding your hand virtually, kissy face."
Oh,
she knows I'm a baby.
Oh, you're doing good.
But honestly, this does not hurt. And I'm not just saying that.
How many times does this have to be redone?
So like I said, everybody holds on to filler differently. This is just like we'd be doing the lips. So I would probably assess for about 9 to 12 months, I would say longevity for this Juvederm Ultra. Doing okay?
Oh yeah, doing good.
Perfect. So as far as downtime, a little less worried about, bruising and swelling. You are still going to get some bleeding because impossible risk of bruising, but most people do pretty well with it as far as healing goes.
How long do you have to wait before wearing earrings again?
She could wear them tomorrow.
Oh, okay. Great.
Yeah.
Someone said, is this treatment one of today's specials?
Yep, so our Juvederm is Group A, so that's what you would be purchasing. So yes, it is.
Yeah, it's not filler specifically for your earlobes. It's
Yes.
just Group A filler.
Group
It can
A
be
filler.
used in many different areas.
Yep. So a lot of patients were asking, I know on some of their, if we were saving syringes, I don't want a lot of filler. Do you do a half of a syringe? And the answer is unfortunately we do not. So this is a good thing to do for a patient, especially if you don't want to just throw away filler, discard it, and you're not going to use the whole syringe. Great place to add filler. So a lot of my patients, if we just do a half syringe of their lips, tear troughs, we can add it to their earlobes, which is amazing, especially since we don't save syringes. So there's always a place to put filler. I always tell patients.
Someone said, does filler harden or build up after a couple years of using it?
So I've never had it harden up. As far as, are you talking this area? It wouldn't harden up in this area. Filler does stimulate your own collagen over time, so which is nice.
But it's not going to get hard. Like,
No.
okay. And then someone said Group A fillers for the lips too, right?
Yes.
It is.
Perfect. That looks
Good.
good.
Thank you so much.
So I use about a half cc.
Oh, perfect.
They feel, I mean, it's amazing how it just already feels.
That's so nice.
Yeah. And you'll have to keep me posted.
Oh, I will for sure.
How'd you do? Good?
Great.
Hold here a little
Oh,
bit.
yeah.
Awesome.
Okay,
Thank you so
thank
much.
you.
Thank you so much.
Thank you.
You did great.
Thanks, girl. You did great.